Welcome to the CURES Show, where we explore the cutting edge of wellness. I'm Kara Sundlin, and I'm very excited to be joined by none other than the #1 New York Times bestselling author and sometimes called America's psychiatrist, Dr. Daniel Amen. Thank you so much for being with us.
Kara, thank you so much for helping me spread this message. It's not mental health, it's brain health. Get your brain right and your mind will follow.
I love that. And I'm a huge fan of the way you have these simple tips to really democratize ways to improve our brain health on social media. So we want to say congratulations on your new book. It's called Change Your Brain Every Day, Simple Daily Practices to Strengthen Your Mind, Memory, Moods, Focus, Energy, Habits, and Relationships. That's a lot, but we can do it, right? I guess your point is we're not stuck with the brain we have.
You're not. I have 11 clinics around the country, and for the last 32 years, we've been looking at the brain with a study called brain SPECT imaging. And what SPECT has taught us is just what you said. You're not stuck, that every day you are making your brain better by what you're doing, or you're making it worse. And you have a choice how fast your brain ages and how healthy it is. But most people, like, there's no class in school on brain health. Isn't that insane? Where your brain learns, your brain loves, your brain saves money, or your brain makes bad decisions. You have to get the physical functioning of your brain healthy. And when you do, everything is better.
And we'll talk about some of the SPECT scans coming up. I mean, you can really see the changes, but when it talks about making major changes with maybe some simple starts, what's one way we can start to bring in more peace and less anxiety with an everyday simple habit?
Well, start every day with today is going to be a great day. The brain is programmed to be afraid. The brain is programmed for negativity because those were the people that survived early on. It's like, okay, something's going to eat me. I need to be cautious. But we don't need that anymore. And so we have to discipline our minds to look for what's right rather than what's wrong. So just start today with today is going to be a great day. And when you go to bed at night, go, what went well today? Go on a treasure hunt looking for even the micro moments of happiness that happen throughout the day. It will set your dreams up to be better. You'll sleep better, and tomorrow will be a better day.
Right, and you call those, stomping out the ants, another negative thought. But this isn't just woo-woo or keeping a gratitude journal for law of attraction. I mean, you say this actually changes the wiring in our brain.
Any negativity disrupts how your brain works. And a number of days I talk about eliminating the ants, the automatic negative thoughts that steal your happiness. We live in a society of undisciplined thinkers. And if you can discipline your mind whenever you feel sad, mad, nervous, or out of control, write down what you're thinking and just ask yourself whether or not it's true. These ant infestations, I mean, you never leave an ant infestation in your kitchen. I mean, as soon as it happens, you're going to deal with it. But too often people leave ant infestations in their brains, and they have panic disorder. They have anxiety disorders. They get depressed. And it's like, okay, first step, clean up the ant infestation. Just write out what you're thinking and ask yourself whether or not it's true.
The other simple tip that I've heard you give, and I would love for you to give it to our audience, is you say with a lot of your patients, you do the kind of one page of their dream.
So there's an exercise in the book. In the book, it's 366 short essays on the most important things I've ever said. And the one-page miracle is one of the most important things. I do it with all of my patients. It's like, okay, what do you want? You got to tell your brain what you want, because then your brain will make it happen. But if you never tell it what you want, you'll just get thrown around by the whims of whatever's going on at work or in your news or in your family. Write out, what do you want your relationship? So, for example, with my wife, I want a kind, caring, loving, supportive, passionate relationship. I always want that, but I don't always feel like that. And these rude thoughts come into my mind. But because I know what I want, I don't say them. What do you want in work? What do you want for your money, for your physical, emotional, spiritual health? What do you want? And then post it where you see it every day. I'm absolutely convinced it's one of the reasons behind my success, because I know what I want, and every day I work toward my goals. And what I find as a psychiatrist, most people have never done that. And so they're just thrown around by the whims or the stresses that all of us have come into our life.
A lot of people have been through so much stress, and anxiety is huge, especially for our young people, but for everyone, especially coming out of the pandemic. You're a psychiatrist. By nature, that means you're very skilled in medications, but I know it's not always your first line of defense. Can we talk about some of the way you, natural supplements, let's talk with anxiety. Where should we start before maybe going on an antidepressant?
Well, so if you're anxious, do not let your doctor give you a benzo, like Xanax or Valium or Ativan. 27, Carol, listen to this statistic, 27% of all doctor visits, so more than a quarter, somebody's getting prescribed a benzo, that we now know are addictive and increase the risk of dementia. Now, don't just stop it if you're on it, but you should talk to your doctor about, how do I get off this stuff? What we have found is ashwagandha, magnesium, theanine, GABA, all decrease anxiety, but there are no side effects. If you're depressed, head to head against antidepressants, saffron has been found to be equally effective. Omega-3 fatty acids, equally effective. Exercise, walking like you're late for 45 minutes 4 times a week, equally effective. Learning to kill the ants, equally effective. So why not, if you're depressed, take saffron, omega-3 fatty acids, walk like you're late, and start journaling the bad thoughts you have and getting rid of them. That's the first thing. And oh, by the way, you should check your thyroid level. You should check your testosterone level. We're in an epidemic of people who have low levels of testosterone, I believe, because of the toxic products we're putting on our bodies.
Yeah, so there's so much to dig into, and I know this book is going to really do it. You've written many books. I've read many, and they're always very accessible. I did promise there's some people on the staff who wanted questions. What about those women? What about insomnia? A lot of people who are perimenopausal or menopausal women, they're like, how do I sleep? What does Dr. Amen tell me I should do?
Well, don't do it with Ambien or with alcohol. That's a bad strategy. First thing is, get your hormones tested. What a lot of women don't know is progesterone goes low about 10 years before women go into menopause. And when progesterone goes low, it's sort of the brain's natural anti-anxiety hormone. All of a sudden, they're anxious, they're irritable, and they can't sleep. So there's like more trouble at home, and they reach for antidepressants or alcohol or marijuana. And my wife often says if she didn't take progesterone at night, she'd be on the nightly news having done something awful. And so often, that simple intervention, 100 milligrams of progesterone at night, now talk to your doctor, but can be just so helpful. Magnesium is also helpful. When you go to bed at night, stop with the worrying and direct your mind. What went well today? And become masterful. And also teach your children, like at dinner. All right, everybody, what went well today? What was the best thing that happened? of your day, training your family to look for what's right rather than what's wrong. I mean, with the pandemic, everybody's focused on how many people died today. I mean, imagine what that did to the mental health of America. It was terrible. We need to get our brains and minds back.
Well, this is a great way to start, and with the new book, I encourage everyone to check it out as well. I know on your website you have ways that you can take a little brain test and see which supplements. You make many of them, so if you're wondering about those things, I encourage everyone to go to your website. I could talk to you all day long, but I know because it's release day, you've got lots of people lined up, so we thank you for your time, and I encourage everyone to check it out. And you know, if you're living in Connecticut, the Amen clinics in New York are not that far away. So Dr. Daniel Amen, thank you so much for sharing your time with us.
Thank you, Kara. Love your brain.
Yes, I'm going to keep loving my brain. Get the book. Thank you. And if you want more information on the cutting edge of wellness, please subscribe to the CURES podcast. We have lots of thought leaders on the topic. You can follow me on social media at Kara Sundlin. Have a great day, everyone, and be well.